Share my screen. All right. Hi, everyone. Welcome back. Stefan Hartman here, PA Iron Direct Primary Care in Melbourne, Florida. And today I have a special presentation for you all, Iodine for Chronic Disease Prevention and Management. And by the end of this lecture, you all will understand the importance of iodine and how ubiquitous a deficiency is in the general population. Um, Iodine deficiency is as rampant as vitamin D deficiency, and this is leading to an epidemic of low thyroid function, low sex hormones, including progesterone, chronic fatigue, low testosterone, low IQ, obesity, breast, uterine, ovarian, thyroid, and prostate proliferative cancers and cystic growths, chronic pain, menstrual cramps, endometriosis, and estrogen dominance syndromes. This is a study we're currently running at our practice. It's assessing iodine deficiency and halide levels in our region, which is Brevard County, Florida. It's a beachside community. It's a first world country where you wouldn't expect iodine deficiency to be rampant. You'd also expect people to, eat shellfish and seafood and maybe have some iodine in their bodies. So we've looked back at the data for the past 4 years, 179 patients of ours. We looked at random urinary iodine, serum iodine, and even the iodine challenge test. And we found pretty much 50% of the patients can meet criteria for WHO criteria, mind you, for moderate to mild iodine deficiency. And the WHO criteria are pretty minimal, right? This criteria is developed for third world countries like Africa and so forth, where cretinism and short stature are a problem due to iodine deficiency. But we meet that criteria here in a first world country. So we can do urinary values. You can order this today with LabCorp or Quest. It's a standard WHO criteria. And if you have a patient with a value less than 100 micrograms per liter, this is considered a mild to moderate iodine deficiency. And we found 50% of our patients met this criteria. We found very few had high or significantly high iodine levels in the urine. You can also look at serum values. You can also order this with any generic lab. And the generic serum labs, they're not a WHO criteria because, drawing blood in a third world country is a little bit more difficult. But the blood value, the reference range that you'll get is typically 40 or 50 to 100. And again, 50% of the patients had a value um, in the moderate to mild deficiency range. So typically, the median was 46 micrograms per liter, and very few had very high levels. So almost no patient had high iodine levels unless they were exogenously supplementing with milligrams of iodine. We're talking 3 milligrams, 6 milligrams, 12 milligrams plus. So these were patients, they were taking the RDA value in a multivitamin or getting it through seafood or seaweed, and none of them had high iodine levels, and most were deficient. And then there's another way to do it. This is the iodine challenge test. If you're familiar with Dr. Brownstein, he's the hero and pioneer after Dr. Abrams, who figured out that everyone needs iodine. So to do this test, it's a specialized testing with special functional medicine labs. And what you do is you do first the pre-test, and that's the random iodine test. It determines the value for WHO criteria. And then you'd give them 50 milligrams of iodine. Now, this is a huge dose that you would never think to give someone. But the reason you give this is to see their iodine saturation. So if you take 50 milligrams and you excrete 25 milligrams in the urine collection for 24 hours, this means that you retained 25 milligrams. And this determines the dose that the patient requires. But in this process, you will dislodge toxic halides, bromine and fluoride in the urine, and you will see just how much iodine it takes to express these toxic halides. And lo and behold, some patients can have detox reactions and feel a little bit uncomfortable when they start excreting through the kidneys these toxic halides. This is what it looks like on paper, this iodine challenge test. You can see the pre-sample is 0.12. So that's pretty low on the reference range per WHO criteria. And you can see how much they excreted. They excreted, um, well, they have 64% excretion rate, so that's pretty low in iodine. You can see this was a female. She was overweight, fatigued, low thyroid. You can see she excreted bromine, 30.5 milligrams in 24 hours, and she excreted 1.2 milligrams of fluoride in 24 hours. And that's pretty high, and that can be considered a toxic level. This is the serum value. This is the testing of the real values we have. And you can see no one is actually high, exceptionally high. Everyone's pretty in the middle of the reference range there, or even below. And the reference range is again 40 to 100. So you can see on that column there in the black, people are pretty much between 48, 41, or below that. No one is taking enough iodine to get a high value. So you can learn this and become a hero for your patients with iodine supplementation. Goiter is here. It is present in the USA. We have goiter. If you run the ultrasounds, if you feel patients' thyroids, you will find goiter in a lot of them. And what is goiter? I mean, I was taught, I don't know what you guys were taught in med school. I was taught in PA school. I would never see goiter. It's not an issue. This is a first world country. I mean, they showed me pictures of African children when they talked about goiter or something very rare. This is common, actually. And this is a problem of iodine deficiency and selenium deficiency. And my hypothesis with this paper is that the RDA, which is about 150 micrograms, is a drop in the bucket. You're not going to get enough iodine to really make a difference. And that's probably why we're seeing such a hypothyroidism and Hashimoto's epidemic here, and many other things, as we'll find out later, including cancer. So iodine can prevent at least 5 different cancers. This is well established in the literature. It can potentially prevent breast cancer, thyroid cancer, prostate cancer, essentially all these cancers that grow from estrogen dominance, right? Estrone dominance, I should say, where you have endometrial proliferation, you get ovarian cysts, you get prostate hyperplasia. This is the hormonal imbalance. Iodine prevents these, and places with very low iodine concentrations in the urine have more of these, such as the Republic of Ireland. That was, I think, the worst preponderance of cancer. And the next was New Zealand and Australia. They also fluoridate their drinking water, which is a point we're going to make a little bit later, too. Again, here's another one. This is a 60-year-old female. She was a medical doctor. She had breast cancer. She wanted to know how bad it was, her deficiency, so she did the test. We found pretty toxic levels of bromide. 6.5 milligrams in 24 hours is what she excreted. And again, these are, if you remember back to Gen Chem 1, the halogen column on the periodic table, you remember that iodine is the least electronegative in that column. That means it has less affinity towards binding to your tissues. So that little 150 microgram dose that you give patients in their multivitamin, it can't outcompete 6.5 milligrams of bromine and even 1 milligram of fluoride that's in this patient. They're sitting in the receptors that iodine would attach to, and iodine never stood a chance. And this is why some of the patients detox when you give them larger doses of iodine. So the reason this MD was doing this is because she was wanting to not do conventional treatment for her cancer, her breast cancer. She wanted to do high doses of iodine, which I helped her with. So iodine is an element. We all know about this, element number 53. It was found I think back in 1811. It comes from the word Greek, meaning iodis, meaning violet colored, reflecting the characteristic deep purple that you can get with these Lugel's iodine liquid dropper. You need iodine and iodide, and this is the remedy for goiter. This was figured out back in 1819. They figured this out a long time ago, but this is knowledge that we've forgotten in modern day because we somehow think we're better than this now. This is a 12-year-old girl. She had breast pain and hardness. So sometimes this can be referred to as a fibrocystic breast disease. It's very common. It's so common, actually. There's a bit of a political correctness going around. I was recently at a steak dinner with a surgeon's, sponsored dinner. They're trying to sell me their fancy breast surgeries. And I stood up at the end. I raised my hand. I was like, "Well, what do you know about preventing breast masses, breast hardness, and fibrocystic breast disease with iodine?" And I got politically corrected by a surgeon. Said we don't call it fibrocystic breast disease anymore. I'm like, "What? What do you call it?" She says it's normal variant breast tissue. I'm like, "Well, are you aware that iodine can reverse this?" And she's like, "There's no data to show that." I'm like, "Okay, I'm going to show you guys the data so you guys know a little bit better." Here's an excerpt from Brownstein's book. I recommend anybody who wants to learn more about this read Dr. Brownstein on iodine. This is that picture we all got in school, third world country person with a goiter. The WHO estimates that 2 billion people worldwide have iodine deficiency, but I suspect it's much more because I've been seeing it here in America as well. Uh, the iodized table salt that was added back in the 1900s to prevent goiter, that's pretty much gone. Everyone's doing sea salt now. And actually, sea salt doesn't have iodine because it's not fortified with iodine. So, where are people getting iodine? Okay, maybe a multivitamin with a little bit. Are they really eating shellfish? I mean, I live on the east coast of Florida. People would eat shellfish here. We're not seeing it. These are more pictures that we all got in school. We saw that. We're like, oh, we're never going to see that. But if you do ultrasounds, lo and behold, you will see, um, you know, thyroid gland hyperplasia, growth, large thyroid, pretty commonly goiter. I know my wife, she was one of them, but she went to a primary care, MD, mind you, and they felt her thyroid. She has a history of Hashimoto's. She told them that, and she asked for an ultrasound. They did it. She had colloidal cysts. If you Google colloidal cysts, the first thing it will say it's an iodine deficiency. But what was she told? And this was before she had medical knowledge, before she went to PA school. She was told they would watch and wait, and if it got worse, they might do something. And what might they do? Well, the conventional therapy, if you have a thyroid abnormality, is ablation or some sort, or radiation therapy. It's not iodine, it's not selenium, and this needs to change. So this is another one, non-toxic single thyroid nodule patient. We gave this patient iodine over 6 months, and it resulted in a smaller size of the thyroid. You can see the measurement here got smaller. But the patient, when she went to the conventionalist, was told we're just going to watch and wait. So why the reluctance? We have this therapy. It's cheap. It's easy. And I'm going to demonstrate how safe it is. But why isn't it used here? Why do we just watch and wait and let the goiter grow and let the cysts grow and then ablate it later? This is the a side-by-side comparison of the iodine pre-test and post-test in the patients that opted for the urine halide test with a company that did this, and you can see their levels. The iodine pre-test varied. Some were very deficient. You can see some were in like the decimal points, like 0.08. This is severe iodine deficiency. Actually, quite a lot of people were pretty low in their pre-test values, not even meeting WHO criteria for even mild deficiency. These were significantly deficient. In the post-test, you can see everyone required approximately about 12 to 20 milligrams of iodine daily. This is the excretion percentage. You can see no one had greater than 90%. So if you have greater than 90% excretion of iodine, that means you're getting rid of it. Your body's intelligent and knows when you don't need it, and you excrete it. It's very hard to overdose on iodine because you just urinate out what you don't need. But actually, zero patients in our population met iodine sufficiency levels, which is greater than 90% excretion. None, actually, none met this criteria. So this is another picture we all got in our medical training. We saw the African cretinistic child. So this is a low IQ, swollen face, big belly. This is cretinism. And this is associated with behavioral disorders, ADHD, poor attention, low IQ. And this is something that we're seeing in our society ever increasing. The rate of this has exponentially increased. And some will say it's, vaccines, some will say it's this, it's that. I mean, fluoride we know causes this. It competes for the iodine receptors, It lowers IQ in children. It stunts their growth because iodine is critical for increasing IGF-1, which we'll discuss later. And so my hypothesis is partially that we may see these behavioral problem rise in children due to iodine deficiency, and you can remedy this with replacement. So this is something very important, and Dr. Halasa, who also is lecturing for you all, asked me to talk about this. He wanted to know the mechanism, what's going on here. So when you give a patient iodine, what will happen? The TSH will rise. So don't be surprised to see this. TSH rises, and the hypothesis is because you're probably giving them back the thing that the thyroid requires to produce free T3 and free T4. So don't base anything off the TSH. You give them the iodine selenium, the TSH will rise, and this may last months until they become iodine sufficient and start producing thyroid hormone on their own. And typically, what we see at our practice is that will happen. The iodine you replace, the selenium you replace, and the TSH goes up. The free T3 goes up as well, but it takes months. It's not fast. It's not like giving a thyroid medicine. It's very slow and it's gradual. Let's see, this is another case, a 30-year-old female. She was overweight, recurrent infectious cyst formations, elevated IGF-1, and now decreasing IGF-1 on Lugol's iodine. So she had an IGF-1 between 350 and 375 or 74, and now it goes below 300 with the Lugol's iodine daily. So you can use the iodine Lugol's solution topically to help treat an infected or cystic tissue. And it's an antimicrobial. We all learned that in our surgical training. What do you do when you make an incision? You paint the area with an iodine solution. This is Lugol's. It's iodine iodide, a little bit different than the surgical type of iodine that's used. So this is a more natural solution. So I asked Grok AI to explain this case. Grok AI suggested that iodine is essential for the synthesis of thyroid hormones, which regulate metabolism. An adequate supply of iodine ensures that the thyroid can produce these hormones efficiently, leading to better metabolic control, which can benefit energy levels and weight management. So elevated IGF-1 might be linked to thyroid hormone imbalance, where excess T4 or T3 could stimulate the liver to produce more IGF-1. By normalizing thyroid function with iodine, the production of IGF-1 might be better regulated, explaining the decrease in IGF-1 levels. Again, as we discussed, the iodine is antimicrobial and anti-inflammatory. Iodine has antimicrobial properties. It combats fungal infections leading to cyst formations. Iodine can help reduce the microbial load on the skin or the mucous membranes, potentially decreasing the frequency of infections. We actually use high-dose iodine to treat toenail fungus. So you give a patient 50 milligrams of iodine over 6 months, and we can treat a toenail fungus sometimes better than using antifungal therapy. I know probably many of you have been frustrated with fungal infections of the toenails. Almost impossible to treat with conventional antifungals unless you do really toxic ones, and then you have a whole other problem to deal with. But we've found iodine 50 milligrams 6 months to be very successful in treating these fungal infections. So safety issues with iodine. Why isn't this recommended more? So we have the medical iodophobia. A lot of you are probably pretty hesitant to use iodine. So you should experiment on yourself first. So that's what I did. So here's a little bit of case of me. So this was my LabCorp results. You can see I had chronically elevated TSH. This was before knowing about iodine, mind you. My free T3 was very low. 2.4 free T3 is terrible. Free T3 2.9 is slightly better. And this, I managed to improve this by taking 3 drops, so 3 milligrams of a 2% Lugol's iodine solution. I did this for some months back when I was still iodophobic. I was worried I would die or something because I was beaten over the head with this in PA school not to give anybody iodine, or you give them Hashimoto's or Graves or something. So I was kind of scared back then. But nothing happened. I didn't increase the thyroid antibodies. Maybe my thyroid peroxidase did increase a little bit, so that's something to monitor, of course. I wasn't probably giving myself enough selenium back then, so I didn't know that yet. But you guys will know that now. The dose for selenium, if you're going to load a patient, is about 200 micrograms twice daily. So you give them 400 micrograms of selenium. This balances the oxidation that iodine causes. And so if you're really iodophobia, you load them with selenium. You can do that for maybe a couple months. And then you can start them on a low dose of iodine, maybe 1 milligram, so one dose, one drop a day, and they can gradually increase their tolerance to it. But I was still hypothyroid. I was cold all the time. My extremities were cold. Um, so I was not good. Here's the iodine challenge test. So you can see my dose was about 12 milligrams a day. So I gave myself 50. I excreted 38 in 24 hours. So that's 12 milligrams. So that was my dose. And I started taking 12 milligrams every day after this. You can see I excreted a toxic load of bromine, 7.7 milligrams in 24 hours. This probably has contributed to my hypothyroidism. I mean, this is hypothyroidism even by conventional criteria. So most conventionalists, they'll just order a TSH and call it a day. So even by conventional criteria, I was hypothyroidism. So my bromine levels were very high. My fluoride levels were decently high as well. So excreting 1 milligram in 24 hours. Um, I think back then I might have been using fluoride toothpaste. I wasn't drinking the tap water. I'm not sure where I was getting bromine other than potentially nuts. Some nuts contain high bromine, as we'll discuss later. Later on, so this is the spring water. We have springs in Florida, and there's Zephyr Hills, there's Culligan's. This is the common spring water brands, and I was drinking out of this 5 gallon container of spring water for many, many, many years. And I finally was suspicious about it because it's a plastic. And so I measured it. So I had the company that sponsored the water, Culligan. I paid for this test and I had 6.3 parts per million of PFAS. And these are endocrine disrupting like plastic fluorides that leach into the water. And they're terrible for you. They're forever chemicals. They get into your testicles, they disrupt hormones. And I was drinking this for many years, as many of my patients do. They're trying to do good. They're trying not to drink the tap water because there's birth control in the tap water. There's lead in it if you're in like Michigan or somewhere. So here I was doing the right thing and still drinking PFAS, causing hormonal dysfunction. So this was after taking 12.5 milligrams of iodoral for several months. I was also taking NP thyroid. So I was taking 90 milligrams of NP thyroid and even 3 units of human growth hormone because my growth hormone wasn't very good either. My IGF-1 was low. So you can see I had a nice improvement. So between taking just iodine and starting with NP thyroid, you can see my free T3 went up to 4.9. My free T4 went up. Actually, my free T4 went down. My free T3 went up though. So that's the NP thyroid because that's a porcine thyroid that gives you both T4 and T3, and T3 being the active thyroid hormone tablet. I test this always after taking it. So I measure my blood 3 hours after taking the thyroid hormone because I want to see what the free T3 is because free T3 has a very short half-life. You would never take the drug the day before and expect to have a high free T3 level on the morning of because the half-life is about, 6 hours that gives you the immediate boost. And then T4 ideally converts over to T3 to give you the longer sustained energy if you're taking iodine, if you're taking selenium, if you have good growth hormone. Look at my reverse T3. So reverse T3 was very low on this test. And that is from taking growth hormone. HGH reduces reverse T3. Reverse T3, if it's high, decreases the conversion of T4 to T3. This is why when you test children, when you test like 7-year-olds, 8-year-olds, maybe up to 16-year-olds, or even 20-year-olds, you'll see always they have low reverse T3. They have high free T3 as if they were taking thyroid medicine and human growth hormone. And why? It's because they're literally taking human growth hormone. Their IGF-1 is like 400, 500 because they're still growing. So that's why they have very good free T3 and they're running circles around their parents because they have all this energy. Also take note that my anti-TPO and my anti-TG is well within the reference range, not going up with this lab, even though I'm taking 12 milligrams of iodine, and of course I'm taking about 400 micrograms of selenium a day. This is a case of a young male. He had low thyroid from years ago. He also had elevated reverse T3. The reverse T3 will inhibit conversion. Simple method to prove this is iodine selenium, but back then I didn't know about the high dose. In this patient's case, I was using a peptide known as CJC ipamorelin. And through that, only that single thing, I was able to increase his conversion. So I decreased his reverse T3. I improved his conversion of T4 to T3, and he felt a little bit better. His glucose metabolism got better too. So that's one way to do it too. You give them growth hormone and then the thyroid gets better too. Growth hormone administration stimulates energy expenditure and extra thyroid conversion of thyroxine to triiodothyroidine in a dose-dependent manner and suppresses circadian thyrotrophic levels. Study in growth hormone deficient adults. And there's studies on this that back up what we're seeing in the cases here. So this is, let's see. This patient, 300 milligrams of iodine daily and 400 micrograms of selenium daily. So this is a patient, she was using alternative cancer therapies. She had a cervical cancer growth, and we were doing a lot of things, including intravaginal suppositories of ivermectin. She had a great result where the cervical dysplasia, it resolved with this therapies. But I want to pay attention here to her thyroid levels. So I'm giving her 300 milligrams. So she's taking 50 milligrams of iodoral 3 times a day. So it was a lot. Look at her thyroid peroxidase. No change. Look at her thyroglobulin antibody. No change. Look at her free T3. Really no significant change there. Her TSH, no change. Essentially no change there. So you can do this. You just monitor the thyroid. You give them the selenium to buffer the oxidation. And, well, we had a good result in this patient. So if you're worried, just monitor them. Placental tissue iodine levels and blood magnesium concentration in preeclamptic and normal pregnancy. Magnesium assimilation is known to be defective when iodine levels are insufficient. The amount of iodine in the human body ranges between 30 and 50 milligram, and less than 30% is present in the thyroid gland. Geographic differences in rates of breast, endometrial, and ovarian cancer appear to be inversely correlated with dietary intake of iodine. Low dietary iodine intake may increase effective gonadotropin stimulation, which in turn may produce a hyperestrogenic state. So we know this increased production of estrone and estradiol, and so you get lower progesterone, and then you get higher estrogen dominant states. This was an interesting study because it looked at how magnesium is important for the placental tissue in preeclampsia. They found that in preeclamptic placental tissues, they all had low iodine levels as well as low magnesium levels. So this is telling us several things. One hypothesis is that the mother is growing a fetus, and the fetus requires lots of iodine to grow, and that this low iodine affects the magnesium assimilation. And we know that magnesium, of course, is the treatment for preeclampsia. If you have some GYNs in the crowd, you give what? You give magnesium in preeclampsia. So we could potentially prevent preeclampsia from happening if we supplement the pregnant woman with appropriate iodine levels, because the pregnancy is a huge iodine sucking up state. They use up so much iodine. And then when they give birth, what's happening? They're excreting loads of iodine in the breast milk to feed the child because the body's intelligent and knows that the child needs iodine to increase IGF-1, to increase the brain growth, to grow the child appropriately. So the woman gets depleted of iodine postpartum. And this leads to potentially a lot of ramifications for women, including hypothyroidism, Hashimoto's. How many women get Hashimoto's postpartum? It's very common. They'll tell you all the time. How many women say, I gained 30, 40 pounds postpartum? Why is this happening? It potentially could be due to slower metabolism, due to lower iodine, and then high estrogen states where they lack progesterone, they have high estrone, they gain more fat cells, they get tired. There's a lot of reasons for this. Look at this patient here. She had a 60% excretion of iodine, indicating a 20 milligram need. She had been struggling with hormone imbalance during certain stages of the cycle, been getting very depressed and crying. And then once my period starts, it's like a light switch turns on. I'm back to myself. I'm about to start my third cycle since having my baby, and it's happened each period. I was fine prior to that, and during 2 to 2.5 weeks out of the month, after I start my period, so I don't suspect that it's postpartum related. Hair loss during pregnancy, chronic weak nails, fatigue, slight enlargement of thyroid. Family history, of course, is related to the thyroid and iodine deficiency. We put her on 50 milligram iodine. Good morning, Stefan. Sorry to message so early, but I just wanted to reach out because I had a question. I started taking Iodoral, half of a 50 milligram tablet a day. Today is day 4. I'm down 5 pounds already and just want to make sure this is okay. She felt like that was a drastic change. Most likely, she's losing some water weight. Iodine might be helping balance the hormones a little bit better. It might be increasing her metabolism. Maybe she's losing accessing water because estrogens holds on to water in the body. This is another one, 40-year-old female, chronic brain fog, ovarian cysts, overweight, also severe reactions to flu, COVID with significant costochondritis and recurrent cold illnesses. She states she has lost 10 pounds since starting iodine. She doesn't feel her ovarian cysts anymore. Her sleep is getting better as well. Yeah, this is that study we mentioned earlier, placental tissue levels and blood magnesium concentration in preeclamptic and normal pregnancy. To the author's knowledge, this is the study. This study is the first to report lower placental tissues of iodine levels in women with severe preeclampsia than in healthy pregnant women. A lower blood magnesium level was also reported in women with severe preeclampsia. So this is a cool study showing that these preeclamptic women are iodine deficient, and we can fix this quite easily. There's an AI of Aragorn holding up Belugal's iodine solution because he's a hero. Here's Legolas. He's got a quiver of iodine, and he's shooting it at the overweight and ADHD patients because he knows that they need iodine. Mouse mammary tumor. So I got this study from Dr. Kathleen Ruddy. She's running a study using ivermectin to treat cancer, and I had a video conference call with her talking about my theory of why these things are happening. And she actually wrote a book on this, on the mouse mammary tumor and how it infects human cells and causes cancer. And she opened up her book again, and she found that I was right. And iodine has long been known to maintain the normal physiology of thyroid and breast tissue. Molecular iodine has been found effective in diminishing mammary dysplasia and atypia resulting from iodine deficiency, the symptoms of mammary fibrosis in women. So she was very happy to remember this really from her own book that she wrote. She knew this, and it was a long time ago. So she started using iodine as well in her cancer protocols because iodine induces cell death as well as autophagic response in these cancer tissues. Here's another excerpt from Brownstein and the cretinistic child in Africa. Here's that lecture I would have liked that breast surgeon who was buying me a steak dinner to have read, but she wasn't open-minded enough to know this. So this was back from her time. They looked at this back in 1975 through 1990s, and there was over 4,000 patient years were observed in a study using 2% Lugol's iodine on fibrocystic breast disease. And I'm going to keep calling that because it is a disease because we can reverse it. 70% of patients improved and observed softening of the breast tissue and mammography improvements. This is absolutely huge because we know mammogram has a high false positive, has a high false negative. And why is this? It's because the poor radiologist has to look at this dense breast tissue and has to try magically to see through it somehow. Help your radiologist friends out. Give them an easier life. Optimize your patient with iodine first. Put the Lugol solution on the fibrocystic breast. Have them do that for a couple weeks, maybe a couple months. Then send them to your radiologist friend. You're going to get such a better result. Radiologist is going to thank you like, wow, all your patients, I can actually read their mammograms and you've made my life so much better. And, we're not sending patients for useless biopsies and we're not missing cancers. Wow. You would think a breast surgeon would have appreciated this. 41-year-old thermography scans. This is another thing you can do, thermography. Reveal findings of estrogen dominance, which is low iodine status. So the same thing applies for me. My patients were like, I don't want to do a mammogram. I'm like, okay. They're like, can I do a thermogram? I'm like, why don't we iodine optimize you first? And lo and behold, this patient had severe deficiency iodine. So yeah, she needed 20 milligrams a day. So that's what I did. Where Where is she? Oh, I think there's another study on this later, but that's what I recommend to make typically to my patients before any sort of breast imaging procedure. This is a good one. 43-year-old mom breastfeeding a newborn. She developed mastitis. I know the treatment for that. I went to VA school. I know it's ampicillin. You use ampicillin for mastitis. But she's like, is there anything else I can use other than an antibiotic? I was like, well, theoretically, you could use some topical Lugol's iodine. Probably won't work, but it can't hurt. She did it. It worked. Her mastitis resolved with 2% Lugol's iodine solution. I was like, well, there you go. Yeah, antimicrobial effects of iodine. Look at this. This is farmers in Japan. They know more than most doctors here. They have found out that the cows that are not fed iodine and selenium, they grow ovarian cysts. And this is in cattle. This is very important for the Japanese, the Wagyu beef. Their cattle are prized to them. So the farmers are very aware of this. And they make sure to spray selenium and iodine on the grass the cow eats, or they'll leave like mineral buckets. And the cows are intelligent. They'll munch on the mineral buckets to provide sufficient levels in the body. For some reason, humans don't have this innate ability to know that they need minerals. They need testing. Here's a patient, 34-year-old female, 50 milligram iodine update. She had zero side effects and almost lost 10 pounds, sleeping better and less fatigued. She previously, as noted, was a week immediately following period is the only time patient can sleep through the night because she will get pain in her ovaries. She'll get ovarian cyst pain. This is her ultrasound. So she's very happy to sleep through the night thanks to iodine decreasing her ovarian cyst pain. Every time you see this pink ribbon, I want you to think of iodine, right? Every time it's like, oh, we need to march for breast cancer. Why don't we march for iodine? 64-year-old on bioidentical hormone replacement, estradiol, testosterone, progesterone. So, Dr. Clearfield, he's really appreciated my work here on iodine because women, when you do hormone replacement, they sometimes will get breast tenderness. And this is a real problem for women when you give them estrogen. But you can balance this by giving them progesterone, sure, but you can also give them iodine. It improves the metabolism of estrogens. It has also a local effect. So if you have a breast tenderness, breast pain, apply the 2% Lugos to the area of tenderness, you will find that they get better. The iodine requirements of the breast tissue is great, especially for the developing female. We're seeing more and more young females developing hypothyroidism. We're also seeing more and more females having low progesterone during mid-luteal phase. This may all be related to iodine deficiency, and we can prevent a lot of problems from forming. We can prevent potentially the fibrocystic breast disease. We can prevent potentially the breast cancers. We can try to detox the fluorides and bromides from these people. Ovarian cyst, 34-year-old female. She's improving with topical Lugol's iodine over the ovaries, the pain resolved. There's some studies on this as well. The dietary iodine and the risk of breast, endometrial, and ovarian cancers. And those with a low intake of iodine have increased risk of all of these. Here's another uterine case. She had chronic uterine cramps, premenstrual dysphoria, history of a goiter, colloidal cysts, a thyroid, old primary, never spoke about iodine. They had always taken NSAIDs every month due to the painful cycle. She's now down about 3 drops of Lugol's. This is the first time she can remember having no menstrual cramping. She has no dysphoria, and she required no NSAID use this time around. So, isn't that significant enough to use iodine? If we can replace a known toxin, which is ibuprofen, with something as benign as an iodine topically. So, here's Brownstein's expert. He's talking about the Japanese population and how high a dose. There's a lot of conflicting theories of how much, but some say the Japanese can consume on average maybe about 12 milligrams of iodine a day in the form of kelp and seaweed. This might be regionally dependent in Japan, but it is a big part of their culture. Patients of mine who visited Japan or stayed there for school, they're like, well, I came back and I now have this seaweed habit. I'm eating seaweed with everything. But well, when they come back here, we Americans, we think that's weird. Oh, are you eating this weed? It's very part of their culture there. And the Japanese have less of these cancers. They have less of the breast and the thyroid cancers. Um, okay, uh, back to medical school. Out of the halogens, which one is the most powerful oxidizing agent? And you can look at the periodic table here for a cheat sheet. Fluorine. Fluorine is the most powerful oxidizing agent. It is the most electronegative element. Oops. Electronegative elements have the property to remove electrons from the elements to which it is attached. So the fluoride, and typically fluorine, sometimes I'll argue, well, the periodic table is just fluorine, it's not fluoride. Fluorine really never exists in nature. It's so electronegative. It immediately binds and becomes fluoride anywhere in nature, right? Only in a controlled lab setting can you get fluorine in isolation. Again, here's your periodic table. Fluoride right there at the top. I'm just going to refer to it as fluoride from now on because the fluorine doesn't exist in reality. Uh, there's bromide, there's chlorine, and then iodine way down there at the bottom, least electronegative. There's been studies on this showing that fluoride is harmful. Our Surgeon General here in Florida has recently announced that it is a neurotoxin and that there's no safe levels. And I agree with him. And this is based off my research that I've done for many years on this, is that fluoride has no safe acceptable levels really in humans. Rat models have demonstrated generational consequences of high fluoride intake in the water. There's case control studies around the world, including in Iran. Cases where they had fluoride in the water tended to have higher TSH values. The Weston A. Price Foundation does not recommend fluoride to prevent tooth decay. We've been having a lot of debates here with local dentists. We've been going to local town hall meetings. My group has been successful in removing fluoride from the water municipalities of Palm Bay, Florida, and Melbourne, Florida. That actually happened this past week. The dentist will argue that fluoride is critical for tooth development, and that may be true for like the first like couple months of developing children, a couple years maybe even, but it actually has no purpose later on in life for adults. I also think that there's other ways to improve dental or prevent dental caries. I mean, we have electric toothbrushes, we have flosses. If you're really wild, why don't you get a Colgate toothpaste? It's there. There's no reason to put it in the municipal water so that everybody needs to be medicated on this. This is unethical, right? This violates Hippocratic Oath, first of all, to want to medicate everybody without consent. Uh, and then it's potentially a neurotoxin, and it is, we know this if we remember our general chemistry training, it is a competitor and it is more electronegative than iodine. And with the data I want to publish here at my practice, where the entire population is iodine deficient, we can make a real strong case for not consuming fluoride, instead replacing the halogens with iodine. What is this? I think we reviewed this already. Fluorine in healthcare, organofluorine containing blockbuster drugs. 30% of the leading blockbuster drugs contain a fluorine atom. So you can get it in a controlled setting. You can bind fluorine to the organic chemistry of all these drugs, including really popular ones like Flonase. Flonase has fluorine atoms attached to it because it makes steroids more potent. It makes them work a little bit better. Here's common drugs. Rosuvastatin, that's a really common one. Flonase, everyone's getting that over the counter. Lipitor, Paxil, Prozac, a lot of antidepressants. Zetia, I forgot about Zetia. Tobradex, what else? Celebrex, a lot of these antidepressant drugs, unfortunately. Side effects, upset stomach weakness, changes in teeth, headache, hives or rash, nausea, vomiting, difficulty breathing. Unfortunately, a lot of the steroids that we use for our asthmatics contain fluoride. Oh, and the Cipro drugs, of course, the fluoroquinolones, the fluorine in those. I mean, it may be contributing to some of the damages that patients get when they're floxed from that. Fluoride, as it relates to the diabetic, there's a large body of evidence of the harms associated with fluoride. This is not widely known. But fluoride makes the person more insulin resistant. So, and this is a huge problem we're dealing with now, all this obesity and insulin resistance here. Insulin resistance in humans caused by chronic fluoride exposure from drinking water is well known. Well, not really. Not a lot of people know that. In chronic exposures, effects on glucose metabolism occurred when plasma fluoride concentrations exceeded zero point 0.1 milligrams per liter, or just 1/15th the concentration allowed in Australian drinking water. In general, impaired glucose metabolism appears to be associated with serum and plasma fluoride concentrations of about zero point 0.1 milligrams per liter or greater in both animals and humans. I've never measured serum levels. I just do the iodine challenge test, but we always find some level of fluoride in people when we try to detox them. Okay, yeah, this is some new court rulings that you may have heard from California. And that's how a lot of this movement has started to get water out of the municipal water drinking. This is why our Surgeon General here in Florida has announced to get it out. Our own health department has told us that it needs to be taken out of the water. And that's from a conference we went to up in Ocala this past year. Japanese culture, we talked about that. Their consumption of seaweed. Why children need iodine. We talked about this. It helps them grow. This is everyone's fear, the medical iodophobia, the Graves' disease, the muggy eyes. I have a patient like this. I'm loading her with selenium, and she's getting better. So I'm hoping to make a full 180 on this patient. I have one patient like this, not from iodine. She came to me like this. She had the exophthalmos. She still has it. She's feeling better, and her antibodies are getting lower with 400 micrograms of selenium. Bromide, another iodine competitor we need to talk about. This is a study done in India, and they found that there was a lot of bromide in bread products. So bromide replaced iodine as an anti-caking agent somewhere in the 1920s or something, and it's been in our own U.S. bread products for a long time. It's still in several countries. I think India, Brazil. Oh no, it's banned in Brazil and the European Union. So you can go to Italy, you can have a nice bread. You can go to Germany, you can have a nice bread. You don't have to worry about bromide. But in other countries, not so good. I get patients, they'll say that they're taking Brazil nuts for their selenium benefit. I'm like, okay, sure, but do you know the farmer? Do you know what they're spraying on their plant? The farmer will often spray a pesticide on the plant that contains bromide. And the Brazil nuts, being by their nature these great absorbers of minerals, that's why they're known for being great for selenium because they're supposed to absorb minerals. But they will absorb whatever is sprayed on them. And if you're not spraying them with selenium, how on earth is the Brazil nuts in a depleted soil supposed to suddenly miraculously have selenium? That's not how it works. You need to feed the soil with the mineral that you would expect the plant to contain. So when people say I eat Brazil nuts for my selenium, I ask them, have you met the farmer? And this is a patient, a 60-year-old male. He was consuming Brazil nuts on a regular basis for his selenium. I have a lot of natural patients. They think that taking a vitamin is like somehow negative or bad. So they want to get it, quote unquote, naturally from plants. So this patient was getting it naturally from a Brazil nut. He excreted 8.9 milligrams of bromine in 24 hours. This is the incredibly high dose. He actually had kidney pain from this because he was detoxing so much bromine. This is bromine pre-test, bromine post-test, so we see a lot. He actually wasn't the highest. So we've had a patient with 11 milligrams in 24 hours of bromine. Most patients will excrete bromine levels. Very few have low bromine levels. So bromine competes. It can cause people some detox reactions. Bromine in bread, it's an anti-caking agent. It induces renal cell tumors, mesotheliomas, thyroid follicular cell tumors in rats. It exerts mutagenic effects and causes injury to the tissues and the central nervous system and kidneys, as one of my patients did experience. He had to go very low and slow with iodine because of the kidney pain he was developing from detoxing the Brazil nut laden bromine. The FDA has now banned bromide since I created this lecture some time ago. So November 2nd, 2023. Maybe they were watching my lectures. The FDA has banned bromide additive in sodas and vegetable oils. But this is probably still in circulation. It's difficult to uh, get it out of all the pre-existing products out there. But it's been at least 2 years now, so maybe it's out. So why might I prescribe 50 milligram? Again, detoxing, growth of the endometrium, prostate enlargement, fibrocystic breast disease, goiter. 25-year-old post-birth control with new onset hypothyroidism, family history the same. She has progressively gained more weight and had more fatigue and brain fog despite 120 micrograms of NP thyroid. Halide testing reveals rather healthy levels of halides. There are no, well, I wouldn't say healthy. No, there's no healthy level of these toxic halides. So we continued this patient on therapy. This is a 48-year-old female, chronic illness, mold sensitivity, fungal colonization in her nares. We could look under a microscope. You can do a swab, KOH prep. You can see the fungi hyphae. Old Navy ship, asbestos, fluoride exposure. She has a lot of chronic pain, chronic sinusitis. So she excreted essentially half of the iodine, indicating that she required at least 25 milligrams a day. And so we've been loading this patient with iodine ever since. It's a cheap test. This is the cheaper one. It's only about $100. You can get just the iodine pre and post load. You won't see the halides. Fluoridation is ineffective. It violates informed consent. Municipality cannot control the dose of the patient. Like if you think a patient really needs fluoride, I mean, you got to prescribe the dose. I mean, there might be some reasons for it. I don't know. Not in my practice. I don't use fluoride. Let's see, 67-year-old. Yes, she had cancer back in 1998 of the breasts. She still has a lot of iodine deficiency. We're loading her with iodine. She's hypothyroid as well. I think there may be a correlation between her hypothyroidism and her breast cancer, likely all related to iodine deficiency and halides. So how to detox from halides? You give them some B vitamins. You have them drink plenty of electrolyte water. Have them use vitamin C. It's an antioxidant, up to 6 grams a day. Have them use selenium. I load them with 400 micrograms now. I've changed some of this protocol. Let's see. This one was probably one of the better ones I'd seen. Excretion showed that she only needed like 14 milligrams of iodine a day. Prostate cancer prevention and iodine. There's a lot of studies that indicate that you can prevent prostate cancer. PSA is great. Rectal examination with prostate. I don't know who even does that anymore. I know I don't. I don't want to do that. I'll do a PSA and I'll optimize their iodine. If I'm really worried, I'm going to do an MRI of their prostate. But iodine deficiency has been reported to be associated with the growth of the prostate. Some references from the Brownstein book, fantastic book. I recommend everybody read. Let's see, we're excited here. You can purchase this on Lugol's off Amazon. You can get the 50 milligram iodine challenge test. You can do that. It's called the halide urine halide test. It's on doctor's data, and then you can get 50 milligrams, on full script typically. Very good. That was a lot of information. What do you guys think? You gonna start using iodine? Anyone there? We'll close it out then.
Can you hear me?
Oh, now I hear you. Yes.
All right, we're going to use the mic. Dr. Clearfield has a question.
Yes, Clearfield. Hey, how you doing?
We're doing good here. So, how are you?
Excellent, excellent. How'd you like my lecture?
I like all your lectures. You know that. So, So, for those of us out here in the iodide phobic world, so where do we begin? Because, as soon as I give somebody iodine, they'll go to an endocrinologist or their other doctor and they'll say, that's poison, that's going to kill you.
Yeah.
Right.
Yeah, they will.
And then you showed examples of 300 milligrams of iodine. I mean, I've not done that much. So I've done 10, I've done 12 and a half, but 300,
Mhm.
I'd have a little, you know, I'm getting too old to have to worry about this kind of stuff.
It helps people though. I have this case, I should have added it here. She is this young girl. She's only 17 years old. She's had lupus for a very long time, and she's gone to every specialist. She went to this DO. They did all this allergy testing, multi-million dollar workup. Simplest solution. She says she's in the best state she's ever been. She has energy. She has no joint pain anymore. What did I do? 50 milligrams of iodine a day and a multivitamin. And she was on this long regimen of all this functional medicine, herbs and stuff, and all these medications, hydroxychloroquine, 50 milligram of iodine, and a simple multivitamin with 400 micrograms of selenium. She says she's been better than she has in years.
All right. So is there a dosing schedule that you use?
Yes, you use the halide test if you want to be scientific about it.
Mm-hmm.
Yeah.
Okay. But you have to keep repeating that so you get to the right point, right?
Yes, you might eventually find someone who's iodine sufficient if they're good about avoiding the toxic halides that compete for the iodine receptors. It remains to be determined how long you need to do these loading doses. It's probably dependent on individuals, but you find out if you give them the 50, how much they excrete, that determines the dose. Yeah, I'm still taking 12.5 milligrams now, 4 years into it. My thyroid is good. My thyroid peroxidase is not elevated. I feel good. Um, so I still take 12s.
Mm-hmm. Okay. All right. But I probably challenge you that there's probably nobody, maybe besides me in this room, that's ever survived diet.
You're fading out. I can't hear you.
He's just commented that he's probably any. I think he's correct. The only one in the room that's up, up, up. We got another one. We got another convert here.
Okay.
We got
Welcome.
a convert here. Okay.
Welcome.
What is the best test to identify iodine deficiency?
You can do a random urine test. It's $40 at LabCorp. You have them go to the lab, they urinate, and you're going to get a result. And you're going to find out that most of them are below 100 milligrams per liter of iodine, micrograms per liter of iodine. And that's going to show that they're WHO criteria deficient. And maybe that can reassure you if you want some WHO evidence.
All right. Any other? Yes.
Hi, it's Dr. Barr. Good morning. Thank you for your lecture. Any cases that you can share with us for men and prostate issues with iodine? I've been using it randomly, but any cases or references?
Yeah, there's a decent amount of references on how it prevents the growth and the hyperplasia of these various organs. So the reason the prostate and the uterus all respond the same is because embryonically in utero is the same tissue, the uterus and the prostate tissue, and it differentiates later in the developmental stage. But it's the same tissue, and it is sensitive to iodine, and it's sensitive to the estrogens, as Dr. Halassa will tell you. So we can use the iodine to prevent the proliferation and the estrone imbalance. However, can it reverse prostate issues? That remains to be seen. I think it's best used as a preventative. Like once the prostate tissue is grown and when you have endometrial hyperplasia, I think it can help, but I don't know if it can reverse it. It's best for a prevention.
Follow-up question. Is there any tests for the prostate to follow your treatment? I know that like the PSA is like the worst test in the world.
Yeah, we are doing MRIs now of the prostate. So, some patients will even get the Ezra, and it's a full body MRI. It's a new test that they're doing down in Fort Lauderdale here. And it's the most accurate way to detect cancer's early stage and to monitor the growth of things. So you do the full Ezra, full body scan, and you can detect tumors pretty readily with that. And then later on, you can follow it with more compartmentalized MRI imaging with whatever treatment you're using, whether that's iodine or whatever.
You know, say you get a MRI of the prostate, are you following prostate volumes or what exactly you're following?
Yeah, you're following prostate volume. See if it shrinks ever. And you're also
All right.
following the symptoms of the patient. Are they urinating less at night? Do they feel better? Is it irritating them? That too is symptomatic improvement.
All right. Any other questions? Yes, you've been most informative. We appreciate you speaking to us today and like to have you back, maybe for our Vegas conference.
Vegas makes me sick. Can we go anywhere else?
Well, you can do a Zoom. You can do a Zoom in Vegas. And a lot of people don't want to go to Vegas.
It's so toxic. You know, it has the highest ozone concentrations of like any city.
Yeah.
Yeah.
No, well, our last meeting, I was out there in Vegas and it was 108 degrees. So,
Mm. Mm-mm.
yeah.
Hopefully, everyone starts using more selenium and more iodine in their practice. You're gonna get a lot of good results.
You know, as far as selenium, can you do the same thing? Can you do a urine measurement on selenium? How
No,
do how do you test for selenium deficiency?
I don't, right? Because it doesn't have the same competitors as iodine does. It doesn't have things in the halide column that competes for its receptors. So most people won't be severely deficient in it. And if you give them, it's a water-soluble vitamin. So you give it to them every day, at least 200 micrograms, and it's good. If you measure it in the blood, it will be high if they're taking it, right? So you can do a serum test and prove it to yourself. Maybe they'll be deficient if they're not taking it, but if they're taking it, it's going to be high. And that's the same thing with iodine. It will be high. So if you measure a serum value on someone who's taking 12 milligrams of iodine, it's going to be very high. But again, it's a water-soluble vitamin. So if it's in the blood when you test it, it's going to be high. But if you're not taking it, it's not going to be there.
All right. Any other questions? All right. Again, we appreciate it. Thank you very much.
Thanks for having me.